Hi friends, good evening. Welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. In the previous video, we discussed one set of questions, that is 100 questions, previous year questions and answers we discussed. In this video, we can see another set of previous year questions. We can see questions one by one. And the first question, which one of the following is a function of liver? Options. Option A, synthesis of carbohydrate. Option B, synthesis of plasma protein. Option C, secretion of cholecystokinin. Option D, concentration of bile. Question, which one of the following is the function of liver? Among this option, correct answer is synthesis of plasma protein. Option B is the correct answer. See here, we can see functions of liver. In functions of liver, first one is carbohydrate metabolism. Okay, in that this liver helps to conversion of glucose to glycogen in the presence of insulin, and also converting liver glycogen to glucose. Okay, glycogen back to glucose in the presence of glucagon. That also one of the function of liver. Okay, carbohydrate metabolism. And the next function, fat metabolism. Okay, fat metabolism, protein metabolism, and also breakdown of erythrocytes and defense against microbes. Then detoxification of drugs and noxious substance. It helps to detoxifying the unwanted drugs and other substances. And metabolism of ethanol, inactivation of hormones, then synthesis of vitamin A from carotene, and also production of heat. Then secretion of bile is also the function of liver. And storage mainly fat soluble vitamins like A, D, E, K. So fat soluble vitamins are stored in liver. And also iron and copper are stored in liver. Then some water soluble vitamins like riboflavin, niacin, pyridoxine, folic acid and vitamin B12 are stored in liver. So these are all the functions of liver. And the next question, the layer of uterus that is left off during menstruation is? Options. Option A, endometrium. Option B, perimetrium. Option C, myometrium. Option D, serous layer. Our question, which layer of uterus is sloughing off or coming out during the time of menstruation? And the correct answer is option A, endometrium. And the next question, what nutrient deficiency cause goiter? Options. Option A, iodine. Option B, calcium. Option C, protein. Option D, carbohydrate. And the correct answer is option A, iodine. Goiter, the deficiency. What nutrient deficiency cause goiter? That is the question. So it is correct answer is iodine. The next question, which is the earliest sign of rickets? Options. Option A, Harrison groove. Option B, Bolex. Option C, rickety rosary. Option D, craniotabs. Our question, earliest sign of rickets. Among this option, option D, craniotabs is the correct answer. Craniotabs means is the excessive softening or thinning of the skull bone. That is one of the earliest sign of rickets. Option D is the correct answer. Next question, where does the fertilization takes place? Options. Option A, infundibulum. Option B, isthmus. Option C, ovary. Option D, ampulla. So fertilization takes place in ampulla of the fallopian tube. Option D is the correct answer. And the next question, dash is also known as ascorbic acid. Options. Option A, vitamin A. Option B, vitamin E. Option C, vitamin C. Option D, vitamin D, which is known as ascorbic acid. And the correct answer is option C, vitamin C. Vitamin C is also known as ascorbic acid. And the next question, splitting by the client with borderline personality disorder denotes? Options. Option A, brief psychotic episode in which the client loses contact with the reality. Option B, a primitive defense mechanism in which the client sees object as all good or all bad. Option C, two distinct personalities with the borderline client. Option D, evidence of precocious development. So here the question, splitting by the client with borderline personality disorder, that denote a primitive defense mechanism. Option B will come correct. A primitive defense mechanism in which the client sees object as all good or all bad. So here correct answer is option B. The next question, how much population is covered by a community health center? Options, option A 3,000 to 5,000, option B 15,000 to 45,000, option C 80,000 to 1,20,000, option D 20,000 to 30,000 population. So question, how much population covered by a community health center? A community health center covers in plain area 80,000 to 1,20,000 population. Option C is the correct answer. But in hilly area, it covers 80,000 population by a community health center. The next question, by which one of the following measures the human immunodeficiency virus does not spread? Options, option A blood transfusion, option B sexual contact, option B shaking hands, option D use of intoxicant drugs. Question, by which one of the following measures HIV or AIDS, HIV virus does not transfer from one person to another? And the correct answer is shaking hands. Remaining blood transfusion can spread HIV, sexual contact, use of intoxicant drug, all can transfer this HIV virus, but it doesn't transfer through shaking hands. Option C is the correct answer. Next question, which one of the following is the process of urination resulting from voluntary and involuntary? Options, option A kidney process, option B glomerular process, option C maturation process, option D prostate process. Question, among this following, which is the process of urination result from voluntary and involuntary? It is from maturation process. Okay, maturation reflex or maturation process is the correct answer, option C. Who discovered antibiotic penicillin? Options, option A Alexander Fleming, option B Edward Jenner, option C Waxman, option D none of this. Who discovered antibiotic penicillin? And the correct answer is Alexander Fleming. Option A is the correct answer. Question, the word emotion etymologically means? Options, to rest, option B to stir up, option C to cry, option D to express. The word emotion etymologically, it means, the word emotion means to stir up. Option B is the correct answer, to stir up. And the next question, which of the following is termed as the fetal blood vessels lying over the internal os in front of the presenting part? Options, option A occult cord prolapse, option B vasa previa, option C cord prolapse, option D cord presentation. The question, which among the following term is termed as fetal blood vessels lying over the internal os? Fetal blood vessels lying over the internal os in front of the presenting part. And the correct answer is vasa previa. Vasa previa means the fetal blood vessels lying over the internal os in front of the presenting part. Option B is the correct answer, vasa previa. Next question, which drug is preferred in urinary and genital infections? Options, option A pifloxacin, option B ciprofloxacin, option C norfloxacin, option D ofloxacin. Drug which is preferred in case of urinary as well as genital infection, it is norfloxacin. Option C is the correct answer, norfloxacin. Question, the memory disorder that affect older adult is? Options, option A insomnia, option B dementia, option C dystrophy, option D dyspnea. The memory disorder which affect older people is dementia. Option B is the correct answer. The next question, which one of the following aspect is not considered as the indicator of hospital system? Options, option A patient satisfaction, option B public relations, option C quality of care, option D machinery. Question, among this, which aspect is not considered as the indicator of hospital system, not considered as an indicator of hospital system. And the correct answer is, it is option D, machinery. And the next question, which drug is used to treat HIV or AIDS? Options: option A, ampicillin, option B, zidovudine, option C, streptomycin, option D, dexamethasone. The drug which is used to treat HIV or AIDS is option B, zidovudine is the correct answer. Zidovudine is the drug of choice for HIV or AIDS. And the next question, what is the cardinal signs of meningitis? Sign of meningitis. Cardinal sign of meningitis. Options: option A, Kerning sign, option B, Chostic sign, option C, Drowsy sign, option D, Ortolani sign. And the correct answer is option A, Kerning sign is the cardinal sign of meningitis. And the next question, the broadband area number that corresponds to primary visual cortex is options: option A 4, option 3, option B 3, option C 41, option D 17. The broadband question, the broadband area which correspond to primary visual cortex is number 17. Option D is the correct answer. And the next question, lack of oxygen in the tissue is called. Options: option A, anoxia, option B, hypoxia, option C, anorexia, option D, cyanosis. Lack of oxygen in the tissue is called hypoxia. Option B is the correct answer, hypoxia. Anoxia means absence of oxygen, anorexia means loss of appetite, and option D, cyanosis means bluish discoloration of the skin. So here lack of oxygen in the tissue is known as hypoxia. Option B is the correct answer. Then what is a bacilli galmetic-guray, BCG? Is a killed vaccine. Option B, toxoid, option C, live attenuated vaccines, option D, immunoglobulin. BCG is a live attenuated vaccine. Option B is the correct answer. Option C is the correct answer. Live attenuated vaccine is BCG. And the next question, which is a macro mineral that the body needs to work? Options: option A silver, option B lead, option C gold, option D calcium. Which among the following is one of the macro mineral which need to work the body properly? Is calcium. Calcium is a macro mineral. Option D is the correct answer. And the next question, the optimal head circumference will be 45 centimeter at. Options: option A 4 month of age, option B 8th month of age, option C 6 month of age, option D 12 month of age. Here the question, at what age the optimal head circumference will come at 45 centimeter. Okay, 45 centimeter at the age of 12 month or 1 year of age. 12 month or 1 year. At birth, the normal head circumference is about 33 to 35 centimeter. The optimal head circumference by the age of 12 months, it reaches about 45 centimeter. And the next question, which one of the following is the last part of small intestine? Options: option A duodenum, option B ileum, option C jejunum, option D appendix. The last part of small intestine is ileum. Option B is the correct answer. Duodenum, jejunum and ileum. Ileum is the last part of small intestine. The next question, which one of the following is an example of the risk for infection in nursing diagnosis? Options: option A actual nursing diagnosis, option B wellness nursing diagnosis, option C risk nursing diagnosis, option D diagnostic nursing diagnosis. Question, among the following which is an example for a risk for infection in nursing diagnosis? Risk for infection in nursing diagnosis is a risk nursing diagnosis. Option C is the correct answer. Risk for infection in nursing diagnosis is related to risk nursing diagnosis. Question, which is the process of assigning specific duties? Options: option A coordination, option B delegation, option C communication, option D supervision. Process of assigning specific duties are known as delegation. Option B is the correct answer. The next question, which is the most suitable position for giving enema? Options: option A prone position, option B left lateral position, option C lithotomy position, option D right lateral position. Suitable position for giving enema is left lateral position. Option B is the correct answer. Next question, effective approach in preventing pulmonary embolism is to prevent. Options: option A chronic obstructive pulmonary disease, option B diabetes mellitus, option C deep vein thrombosis. Question, which is the effective approach to prevent pulmonary embolism? Pulmonary embolism is to prevent deep vein thrombosis. Option C is the correct answer. And the next question, Down syndrome is also known as. Options: option A trisomy 21, option B trisomy 18, option C monosomy 13, option D trisomy 13. Down syndrome is also known as trisomy 21. Trisomy 21 is known as Down syndrome, and trisomy 18 is known as Edward syndrome, and trisomy 13 is known as Patau syndrome. Here Down syndrome is trisomy 21. And the next question, facial palsy is also known as. Options: option A Erb's palsy, option B Clump's palsy, option C Bell's palsy, option D brachial palsy. Facial palsy is also known as Bell's palsy. Option C is the correct answer. And the next question, in which stage of labor the placenta is delivered? Options: option A fourth stage, option B third stage, option C second stage, option D first stage. Question, in which stage of labor placenta is delivered? Placenta is delivered in the third stage of labor. In the third stage of labor. In the third stage, there is separation, descent and expulsion of the placenta and its membrane. All occurs in the third stage of labor. First stage of labor, there is full painful uterine contraction to the expulsion of that mucus and the blood from the vagina. That is full uterine contraction is the first stage. And in the second stage of labor, full dilatation of the cervix to the expulsion of rupture of bag of membrane and expulsion of the fetus. That all comes in second stage. And in this third stage of labor, there is separation, descent and expulsion of placenta with its all membrane. That is the third stage of labor. Which theory was developed by a nurse? Options: option A uncertainty in illness theory, option B job satisfaction theory, option C hierarchy of need theory, option D social cognitive theory. Here the question, the theory which was developed by a nurse is uncertainty in illness theory. Option A is the correct answer. And the next question, life-threatening condition due to rapid loss of blood or body fluid is known as. Options: option A neurogenic shock, option B hypovolemic shock, option C septic shock. Here question, life-threatening condition due to loss of blood or body fluid is known as hypovolemic shock. Option B is the correct answer. Option B. And the next question, which causes Klinefelter syndrome? Options: option A XXY, option B X0, option C XS. Klinefelter syndrome means male with one extra X chromosome. So here extra X chromosome is XXY. Option A is the correct answer. Klinefelter syndrome means male with one extra X chromosome. So option A is the correct answer. Next question, what is the renal threshold value of glucose? Options, it's a direct question. Option A 188 milligram per deciliter, option B 185 milligram per deciliter, option C 180 milligram per deciliter, and option D 182 milligram per deciliter. And the correct answer is renal threshold value of glucose is 180 milligram per deciliter. Option C is the correct answer. And the next question, which one of the following includes the immediate step in resuscitation of a newborn? Options: option A, clearing the oral and nasal airway. Option B, routinely giving sodium bicarbonate. Option C, squeezing the chest to remove secretion from the airway. Option D, suction of the baby's stomach. So question: what is the immediate step? What is the immediate step in a resuscitation of newborn? Is to clearing the oral and nasal airway is the immediate steps to resuscitate a newborn. Option A is the correct answer. And the next question: which is not a therapeutic communication techniques? Among this, which one is not a therapeutic communication technique? Options: option A, automatic response. Option B, humor. Option C, reflection. Option D, informing. And the correct answer is option A, automatic response is not a therapeutic communication technique. Next question: standards of mental health practices are published by. Options: option A, State Nursing Council. Option B, American Nursing Council. Option C, Trained Nursing Association of India. Option D, Indian Nursing Council. Standards of mental health are published by American Nurses Association. Option B is the correct answer. And the next question: antipsychotic drugs are prescribed to decrease the psychotic symptoms by. Options: option A, inhibiting production of enzyme monoamine oxidase inhibitors. Option B, blocking reuptake of norepinephrine and serotonin. Option C, blocking the action of dopamine in the brain. Option D, depressing the central nervous system. So why antipsychotic drugs are prescribed to decrease the psychotic symptoms? So it is mainly to block the action of dopamine in the brain. Option B is the correct answer. The next question: what are the immediate side effects of ECT or electroconvulsive therapy? Options: option A, temporary memory loss and confusion. Option B, permanent memory loss and brain damage. Option C, myocardial infarction, cardiac arrest. Option D, fracture and dislocated bone. So immediate side effect of electroconvulsive therapy is to temporary memory loss and confusion. Option A is the correct answer. Immediate side effect. And the next question: which function is transmission of sound vibration to internal ear? Options: option A, vestibule. Option B, tympanic membrane. Option C, eustachian tube. Option D, auricle. Among this, which one helps to function the transmission of sound vibration to internal ear? And the correct answer is it is with the help of tympanic membrane. Option B is the correct answer. And the next question: which is the cause of anuria? Options: option A, appendicitis. Option B, pyrexia. Option C, gastritis. Option D, renal failure. Anuria means absence of urination. Okay, so it is one of the main causes renal failure. Option D is the correct answer. Question: the three-tier system of Panchayat Raj was recommended by. Options: option A, Kaka Kalekar Committee. Option B, Belivand Rai Mehta Committee. Option C, Simon Commission. Option D, Jay Prakash Narayan Committee. Question: the three-tier Panchayat Raj system or the three-tier system of Panchayat Raj was recommended by Belivand Rai Mehta Committee. Option B is the correct answer. And the next question: all green plants and bacteria which can synthesize their food by photosynthesis come under the category of. Options: option A, indicators. Option B, decomposers. Option C, producers. Option D, food givers. So all green plants and bacteria which can synthesize their food items are come under producers. Option C is the correct answer. They are producers. And the next question: the normal IQ level of human beings is. Options: option A, 90 to 110. Option B, 80 to 100. Option C, 110 to 120. Option D, 120 and above. Normal IQ level is between 90 to 110. Option A is the correct answer. Next question: in which condition oral pills should not be given to a woman? Options: option A, menstrual problem. Option B, vaginal infection. Option C, hypertension. Option D, asthma. So oral pills are not given in case of hypertension. Option C is the correct answer. And the next question, pyridoxine is otherwise called as options. Option A, vitamin B12, option B, vitamin B2, option C, vitamin B6, option D, vitamin B1. Pyridoxine is vitamin B6. Option C is the correct answer. Option C, pyridoxine.